Help sex with migraine? With a pounding headache, nausea, and a strong need for rest, most people with migraines don't feel like having sex. Still, one study suggests that sex can help relieve migraines and headaches. The other way around, however, sexual intercourse can also trigger the discomfort. The exact background is still unclear. Find out everything you need to know about the topic here. Sex for headaches and migraines. According to a study, around 2/3 of migraine sufferers refrain from sex during an attack. However, those who tried it came to a surprising result: 60% felt their symptoms improved. This may be due to the fact that the people are distracted on the one hand, and on the other hand they release more endorphins. The so-called happiness hormones suppress pain and in many cases trigger a feeling of elation. Furthermore, the relaxed state after an orgasm can help relieve pain. Sexual activity can take place alone or with a partner. The effect remains the same. In general, more men than women benefit from having sex for migraines and headaches. In 33% of the study participants, sex did not help against the headache. Some even reported that their symptoms were getting worse. Interesting. In patients with cluster headaches, only 37% experience pain-relieving effects from sex. Since the pain is very strong with this disease, the influence does not seem to be sufficient for most of those affected. Sex as a trigger for migraines. In contrast, sex can also trigger migraines or headaches. In this case, medical professionals speak of a sexual headache. These can occur during or after sexual intercourse and last only a few minutes or develop into a migraine attack. Experts suspect a possible cause for this in the sudden change in blood pressure in the brain, which may lead to an incorrect supply. Sensitive people can react with a headache. So, if you have headaches or migraines after sex, it is best to see a doctor. He can use various tests to determine whether there is a treatable cause. More desire for sex through serotonin with migraines? Another study was able to demonstrate an increased libido, sexual desire, in migraine patients. The scientists see the connection in the messenger substance serotonin. An increased serotonin level is considered to be pleasure-inhibiting. In migraines, however, the level is often below normal, which can be the trigger for increased sexual interest. However, since the number of study participants was small, further research on the subject is necessary. Conclusion. Sex can help against migraines, but it doesn't have to. The scientists who carried out the study on sex for headaches themselves indicate that their study is only of limited informative value. A general recommendation for sex as a pain reliever for migraines and headaches cannot be made. In addition, the mechanism has not been conclusively clarified, so that further research is necessary. Patients can only find out for themselves whether sexual intercourse really helps. But of course only if you feel like it. Nobody should put themselves under pressure. This can make a migraine worse rather than better.